Welcome. In this video, we'll be exploring atrial fibrillation, a common heart rhythm disorder that affects millions worldwide. We'll delve into what causes it, how it affects your heart, and what you can do to manage it effectively. Atrial fibrillation, often called AFib, doesn't have one single cause. Instead, it's usually a combination of factors that weaken or damage the heart's electrical system. These factors can include high blood pressure, coronary artery disease, heart valve problems, heart failure, congenital heart defects, thyroid disorders like hyperthyroidism, lung diseases like COPD, sleep apnea, excessive alcohol consumption, and even sometimes viral infections. In some cases, no underlying cause can be identified, which is known as lone atrial fibrillation. Now, let's understand what's happening inside your heart during AFib. Normally, the heart's upper chambers, the atria, contract in a coordinated way, guided by electrical signals originating from the sinoatrial node, the heart's natural pacemaker. In AFib, these electrical signals become chaotic and disorganized. Instead of a strong, coordinated contraction, the atria quiver or fibrillate rapidly and irregularly. This irregular atrial activity leads to an irregular and often rapid heart rate. Because the atria aren't contracting effectively, blood can pool in the atria, increasing the risk of clot formation, which can then travel to the brain and cause a stroke. Atrial fibrillation is the most common type of heart arrhythmia. Its prevalence increases with age, affecting about 9% of people over the age of 65. Men are more likely to develop AFib than women. Certain ethnicities, particularly Caucasian individuals, may have a higher risk. The increasing prevalence of risk factors such as obesity, high blood pressure, and diabetes is also contributing to a rise in AFib cases worldwide. The symptoms of atrial fibrillation can vary widely from person to person. Some people experience no symptoms at all, while others may have debilitating symptoms. Common symptoms include palpitations, a feeling of a racing, fluttering, or pounding heart. Other symptoms can include shortness of breath, fatigue, dizziness or lightheadedness, chest pain or discomfort, and weakness. It's important to note that these symptoms can come and go, and their severity can fluctuate. Diagnosing atrial fibrillation typically involves an electrocardiogram, or ECG. An ECG records the electrical activity of your heart and can clearly show the irregular rhythm characteristic of AFib. In some cases, AFib episodes are intermittent, so a longer-term monitoring device, such as a Holter monitor or an event recorder, may be needed to capture the irregular rhythm. Other tests, like blood tests to check thyroid function and an echocardiogram to assess the structure and function of the heart, may also be performed to help determine the underlying cause and assess the overall health of your heart. While the treatment goals for AFib are generally the same, to control the heart rate, prevent blood clots, and possibly restore normal rhythm, the type of AFib a patient has is sometimes used to describe treatment strategies. For example, paroxysmal AFib is when episodes start and stop on their own, usually lasting less than 7 days. Persistent AFib is when AFib lasts longer than 7 days. Long-standing persistent AFib is a fib that has lasted longer than 12 months. Finally, permanent AFib is when AFib is present all the time, and a decision has been made not to try to restore normal rhythm. Treatment for atrial fibrillation focuses on two main goals: controlling the heart rate and preventing blood clots. Rate control medications, such as beta blockers or calcium channel blockers, help to slow down the heart rate. Rhythm control strategies aim to restore and maintain a normal heart rhythm. This can be achieved through medications called antiarrhythmics or through procedures like cardioversion, which uses an electrical shock to reset the heart's rhythm. Another procedure is ablation, where a catheter is used to destroy the tissue in the heart that's causing the irregular rhythm. Blood thinners, or anticoagulants, like warfarin or direct oral anticoagulants, are crucial for preventing blood clots and reducing the risk of stroke. While you can't eliminate the risk of developing atrial fibrillation entirely, you can significantly reduce your risk by adopting a heart-healthy lifestyle. This includes controlling high blood pressure and cholesterol, maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, exercising regularly, managing stress, limiting alcohol consumption, and avoiding tobacco use. Managing underlying conditions like sleep apnea and thyroid disorders is also important. The prognosis for individuals with atrial fibrillation varies depending on factors such as the presence of other heart conditions, age, and overall health. Untreated AFib can lead to serious complications including stroke, heart failure, and a reduced quality of life. However, with appropriate treatment and management, many people with AFib can live long and active lives. Recent research is focusing on improved methods for early detection, personalized treatment strategies based on individual risk factors, and less invasive ablation techniques. Researchers are also exploring novel targets for drug development aimed at preventing and treating AFib more effectively.